After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers.
Could you tell me your name, please?
Shannon Gloria,
And what's your date of birth?
4/10/65.
Wonderful. Okay. So the first thing we want to do is just look at your hands and find a good place to do our test.
To perform a blood glucose test, begin by assessing your patient. Note in particular the condition of the skin at possible puncture sites, such as the fingers and forearms. Look for edema, inflammation, cuts, and sores. Avoid bruised areas and open lesions. The patient should be positioned comfortably in a chair or in the semi-Fowler's position in bed.
This one, but before we proceed, I'd like you to just get up and wash your hands for me.
Okay.
I have your blood glucose testing equipment that you'll be taking home with you that
Okay.
I'd like to go over with you.
Okay.
Keep in mind that many types of blood glucose meters are available. You must follow the manufacturer's specific instructions for the model you're using. Remove the reagent strip from the vial and tightly reseal the cap. Insert the test strip into the meter, taking care not to bend it. The meter will turn on automatically. Check the code on the vial. Use only the test strips recommended for the glucose meter you're using. Some newer meters don't require a code, and others have a disc or drum that contains 10 or more strips. Then prepare a single or multiple-use lancet device. Remove the cap and insert a new lancet. Twist the protective disc off the tip of the lancet and replace the cap on the device. Then cock it and adjust the puncture depth. Apply clean gloves and select a puncture site in a vascular area. In a stable adult, the lateral side of the finger is usually a good choice. Be sure to avoid the central tip of the finger. It has a denser nerve supply, and pricking the skin there can be painful.
Okay, so what I want to do now is clean the site there on your finger.
Wipe the puncture site lightly with an antiseptic swab. Hold the area of the puncture site in a dependent position. Don't milk or massage it. Hold the tip of the lancet against the skin at the intended puncture site and press the release button. Some devices allow you to see the blood sample forming. Remove the device. If you don't see a drop of blood, gently squeeze or massage the fingertip until a blood drop forms. Make sure the meter is still on and bring the meter with the test strip already in place to the finger.
Just reinsert that there. Looks like we're ready.
The blood will be wicked on to the test strip. Follow the specific instructions for the meter you're using to be sure you obtain an adequate blood sample. The test result will appear on the screen of the meter. Some devices emit a beep when the blood glucose measurement has been made. Now you're all finished. Turn off the meter if your model doesn't turn off automatically. Dispose of the test strip and lancet in the proper receptacles. Then remove and dispose of your gloves and perform hand hygiene. As part of your follow-up care, assess the puncture site for any bleeding. Discuss the test results with the patient and give her a chance to ask questions. If she has been newly diagnosed with diabetes mellitus, encourage her to become an active participant in her own care as soon as she feels ready.